Hello, my name is Kathryn Lodwick-Jones, and I am a licensed professional counselor and board-certified dance movement therapy. Before we get started, I have a question for you. Do you ever find yourself having a hard time being present or focusing in therapy, and it's not about the content and your therapist feels like a good fit? The answer is yes. I hope you'll stick around a little longer. Many of my clients are coming from a prior engagement before coming to our therapy session, whether it's virtual or in the office, whether they're rushing to work afterwards, maybe they're coming from picking up their kid, maybe they are just still trying to figure out what their boss meant in that email. Either way, I completely understand that it can be really hard to stay present in the 55 minutes that we have together. And at the same time, it's imperative that you are able to take the intentional time to be as present as possible so that you can get the most out of your session. So today I want to talk about a couple different tips that I recommend to help you be as present and grounded as possible to prepare for your next therapy session. The first tip that I have is to keep a therapy journal. Now, you don't have to write in all the time like a diary, but I do recommend to all my clients, whether we're meeting weekly or bi-weekly, just to have a designated space, whether it's a notebook or a journal or a notes app, just to jot things down between sessions so that they can remember what they want to talk about. And maybe you'll reference it right before our session, maybe you'll bring it in. It just helps us stay on track and focus on the things that you really want to prioritize. My second tip is to plan ahead as best as you can. And so whether that is really being intentional about the transition before therapy, so minimizing distractions, maybe extending your transition to therapy so you have a little bit more time, or ideally taking the time before your therapy session to really ground yourself, whether that's doing a meditation or a body-based grounding, or it can even be looking through your journal, just trying to create that transitionary period. My third tip is to, of course, talk to your therapist if you have concerns. They too want you to get the most out of your session. And so whether that's asking for a grounding ritual in the beginning, depending on their approach, you might do a meditation or some body-based work or some breath work, whatever it may be. They don't know how to support you unless they know, hey, I'm having a hard time being present. My last tip before we do a brief grounding is to consider how you're coming into therapy. And I mean that both literally and figuratively. So thinking about, am I physically comfortable coming into therapy? Am I running from work and I'm in dress pants and a button down and I can't even breathe in my clothing? Seeing if you can think ahead and plan to wear comfortable clothing so that you're not distracted or uncomfortable. And thinking about the transition period too, right? Can we minimize distractions? If you're virtual, can we change the environment so that you can be as present as possible? Just trying to think ahead to see if we can reduce any excessive stimuli. And my last tip is to engage in some type of body-based grounding. And so ideally, you would take about 15 minutes before your session, but if you only have 5, or maybe you do it earlier in the day, I recommend finding a quiet place, quiet space. You don't have to close your eyes, you don't have to lay down. You can stay seated like I am, or you can be standing if it seems safe. And we're gonna do just a brief body scan. And so what that means is I invite you to close your eyes. You're going to just envision your whole body from your head to your toes. And here we're just gonna think about our body and envision the whole thing top down and see if we can notice any areas of tension, any areas of holding. See if we have any strong emotions in our body. We're not trying to change anything. We might not even try to let that go, but just bringing a little bit more awareness of what is going on. You can practice deep breathing. You can practice progressive muscle relaxation, really whatever feels good in that moment. And then if you want to take the time to jot that down, to bring that into your session, maybe that's a talking point. Maybe it's, I'm feeling really tense in my shoulders today. or maybe it's noticing that I'm still holding a little bit of antsiness in my stomach. Whatever it may be, using our body as a tool and a resource to both inform us how we're doing, but to also self-soothe and be present. I hope these tips help you to prepare for your next therapy session and all the awesome work that you're doing.